You're watching KHQ, your local news leader.
Right now, Dan Kleckner and Stephanie Vigil. This is KHQ Local News at 5.
Hi, I'm Julie Humphreys. Well, you eat right, you exercise, your cholesterol and blood pressure are low, so you shouldn't have plaque in your arteries, right? Well, not so. Tonight, an ultrasound test that is turning up plaque in unlikely candidates. Candidates like Audrey Weeks, who came to Spokane's Heart Attack and Stroke Prevention Center a few years ago.
I walk, I eat pretty well. I never had a weight problem, so I was surprised.
Surprised that she had plaque in her arteries. It showed up on this test, an ultrasound image of the carotid artery on the neck, referred to as a CMT test. The carotid artery is used as a window to the rest of the vascular system, and the test is backed by the American Heart Association as a viable and valuable picture of one's arteries. It basically shows that silent plaque or disease that leads to heart attacks.
We can find plaque in our arteries and find out why it's there in the first place. If we treat the why, we can see the plaque stabilize. So you can live a long and healthy life with plaque in your arteries as long as it's stable.
If it's not stable, the plaque can break through the artery wall. That's when heart attacks happen. So this is true prevention, says Doneen, that is starting to replace the current heart attack risk guidelines. Age, sex, do you smoke, etc. Guidelines that are good, but are missing a lot of people. CMT testing is also used if you've already had a heart attack. It looks at whether your treatment is in fact stopping and stabilizing the plaque. Plaque that doesn't have to lead to death.
It's very treatable. We just need to educate ourselves and people on why they have it.
So why do we have plaque if we eat right, have low cholesterol and blood pressure? Well, generally, and of course this depends, generally though, it is genetics. Julie Humphreys, KHQ Local News. We're going to take a break. We'll be back with sports in just a moment.